Hello, everyone. My name is Korkor. I'm the founder and the CEO of AB Korkor Foundation for Mental Health. Welcome you to this series of webinars that we will be discussing the impact of COVID-19 on mental health in children and provide guidance to parents and family members in dealing with it. This clearly has been a huge challenge for not only our society, our country, but for the world. This is a new event that has really impacted the life and soul of so many of us, and especially children. This is a part of an educational seminar series that we're providing at the AB Korkor Foundations to help all of you and to help you express your questions, your concerns, and provide you the experts that would be able to help us through the process. We are so delighted to have with us today Dr. Ellen Burkard. Dr. Burkard is a professor, department chair, director of training, counseling psychology at the doctoral program at Marquette University. He will start out with a slide presentations, and then please go ahead and send us any questions that you may have. You can write your questions on the right side of your screen, and I will take a look at those. And towards the end of the presentation, we will have your questions addressed. Dr. Burkard, thank you so much for joining us with this presentation, and I really look forward, and I know all of us do look forward for the valuable information that you're going to be providing us with. So,
thank you.
The stage is yours.
Thank you, Adele. Thank you, Adele. I really appreciate it, and I'm really glad to be here. I'm just going to take a moment to bring up my slides here. So as Adele said, and again, I really appreciate the opportunity to talk with all of you about this particular issue related to how COVID might be affecting our children and how they cope with it. As Adele said, I'm a professor of counseling psychology at Marquette University, but I'm also the consulting psychologist with the behavior clinic at Penfield Children's Center, where we actually provide treatment for young children with trauma from ages 0 to 6. So, and I also want to acknowledge this is actually a part of a two-part presentation. I'm going to be specifically talking about the effects of COVID on children and how they cope. And Courtney Clark will actually be presenting on parenting strategies. So I won't delve as directly into the parenting strategies, but I will talk about coping strategies. And then Courtney will follow up next week as it relates to parenting strategies. So let me give you a little bit of an overview for what I'm hoping to talk about today. The first part of the presentation, I'm going to provide some context for you. And a lot of that context is going to focus on kind of the effects of COVID on family. We really can't talk about children unless we talk about families and the impacts on families. So we'll take a little bit of time to talk about that. We'll also talk about the effects on attending school, and then some of the mental health impacts that we're seeing already on children. I do want to take a few minutes to talk a little bit about parent recognition of child mental health needs, and particularly stress responses, and then also cover the idea of a stress response and what that looks like. And then as I will kind of bring that back around then to talking about COVID and connecting it then to how our children cope, particularly in this pandemic. At the very end of the slides, I won't cover this per se, but there are some resources that you might find useful both to families and to working with children. So let me jump into some of the background information. So, first of all, this pandemic is an unprecedented situation. We really haven't seen anything like this. And we have had parallel situations when we've experienced disasters that have been disruptive to families and to their normal routines. But this pandemic, we're well into our fourth month where many things have been shut down. And so it really is an unprecedented situation. For families, that has had a tremendous impact on parents. And when I use the term parents, I'm using that generally to cover all caregivers, whether that's single family parents or single parent families, both a mother and a father, partners, whichever parent unit is kind of the head of the household. But for parents, they've had a pretty significant disruption to their work life. And in some cases, parents' work has changed from being in the office to at home. In other cases, as in the case with essential workers, their work situation has suddenly become a place of risk. And so for parents, it really has become a challenging situation. One of the ways that they're experiencing that is through financial challenges. And we're seeing about 71% of families are really concerned about money due to the changes with the pandemic. Another 51%, we're certainly seeing some adjustments in terms of budgets. And another 26% have lost wages, either entirely or portions of wages. So this is pretty significant financial and stressors on families that they have to contend with. But in addition to that, we're also seeing dramatic role changes. So as families have shifted from being in the workplace to at home, suddenly we see parents combining the roles of being caregivers, educators. They're the recreation directors in their homes. They're looking at, while they're doing that, they're also looking to maintain their career and work activities. And these boundaries have all gotten very blurred. And within that context, we also see that about 76% of parents are really pretty worried about their child's emotional and mental health well-being. So there has been a tremendous amount of effect of the pandemic on families generally, and specifically on parents. When we look at what's happened with schools, we've seen nearly 94% of schools have been shut down, and many have been shut down since about the early part to the mid part of March. And we also have a tremendous amount of uncertainty about what is going to happen in the fall semester, and I'll talk about that more in a little bit. But in the fall, there have been guidelines that have been published. Certainly the CDC has put out guidelines on reopening of schools, but you can literally see district by district what is occurring is going to look quite differentiated. In fact, I know that my daughter is actually a fifth grade teacher down in Illinois, and they're going to have staggered starts with only about half of the students coming to class every other day. So how fall is going to be rolled out is going to be significantly affected. We also know that about 1 in 7 children lacked access to the internet, and that was one of the big strategies when we closed schools down, was to move things online and create virtual learning environments. And yet we have, a significant number of children not really having access to the internet and to these online strategies. And those families that have lower income actually have much less access. We're also seeing a huge and disproportionate delivery system through these online systems. So just to give you an example of this, the school district of Philadelphia literally assumed that children would not have access in their district to the internet to be able to access online resources. So as a result, they decided not to offer online instruction until all students could access it. And what this meant is they didn't literally offer online instruction until early May. It was actually May 4th when they started instruction. So there's really disproportionate delivery of educational services, and particularly in ethnic minority communities, we're seeing more pressure in this particular area. I also want to note the variation of how online education is being delivered. So I noted my daughter, who is an elementary instructor, her district actually provided all of the online education, and she was really there to answer questions. And in my discussions with her, she really only answered a few questions each day. My niece is also a teacher up in the Minneapolis area, and she was online with students starting at 8 o'clock in the morning till 3:30 in the afternoon, providing asynchronous instruction. So even city by city, we're seeing great variations in how the services or how education is being delivered. Then we can take a look at the mental health effects on children. And children are reporting that they're scared, they're anxious, they're confused, and they're feeling really pretty stressed and pretty unhappy. So we're hearing that report. The other thing that children are saying, and a large part of this has to do with the fact that schools are closed, is that they're bored at home. And in fact, I know my daughter receives several videos from her students reporting over and over and over, "I'm bored, I don't know what to do." So we do see this effect on children, both emotionally and then just in terms of that boredom and trying to figure out what to do. Another 49% of children are really expressing concern over their parents or a loved one due to illness due to COVID-19. So children are pretty aware of what's happening with this illness and the effect it is having on their families. I also want to note again that access to care is also an issue. So we know that roughly around 21% of children ages 19 to 17 have some type of mental health issue that they need treatment for. And yet only about 16% of these children actually receive services. And even more striking is that typically 70 to 80% of those services occur through schools. So with the closure of schools, we're seeing a tremendous amount of pressure being put on those students who are particularly affected with mental health concerns. I also want to note, again, the disparities in healthcare services that in ethnic minority communities, in low SES, low income situations, we're often seeing that those individuals have less access to mental health care services, and when they do receive them, they're often receiving poor quality of care services. So that's a particular concern to note as well. I really want to note the breakdown of our normal services for providing mental health care to children and students in schools. So then that kind of takes us to, whoops. I apologize, one of my slides is missing. So I'll just take you through this, that one of the things that we know is parents often underestimate the mental health needs of their children. And one of the things that the research indicates is that parents often don't actually recognize mental health needs and particularly stress effects. For example, in one particular study, about 20% of children reported having great worry about stress in their lives, when only about 3% of their parents actually recognized that the stress was that extreme in their child. In another study, we saw that 33% of children reported headaches, which is a common sign of stress in children, and yet only about 13% of parents saw these symptoms as being stress-related. Relatedly, we also saw children, about 44% of children reporting sleep difficulties. And in those instances, about 13% of parents recognize these sleep difficulties. So there's something about the disconnection at times for parents that they're not always seeing the mental health or the stress symptoms in their children. So it's important that during this particular pandemic that maybe we attune ourselves to those stress symptoms. So let me talk a little bit, oh, there's the slide. So I'll move on from that. Let me talk a little bit about the stress response. and then I'll relate it to children specifically. When we look at the stress response, so what happens when we experience a stressful situation? And I think one of the common ones that we talk about is the individual that might start to walk across the street and then all of a sudden experiences this car coming at them, and they have this reaction. And the reaction is usually one of fight, flight, or freeze. And so, and the reason we have that response is there's a biological process that takes place in our body where we perceive this stressful event. The hypothalamus sets off an alarm in our body, which releases a hormone through the adrenal gland called cortisol. Cortisol actually prepares our body for these stressful situations. And so we see increases in heart rate, our breathing starts to increase, and our lungs dilate. And then we also experience this release of glucose in the body to kind of prepare our body for action. So this is a pretty actually normal response in the face of stress. And actually cortisol levels at times are quite useful in our body. So what helps us wake up in the morning. It contributes to our ability to exercise. It actually can help with memory. It can strengthen our heart. It can regulate blood pressure, even increase our immune system. So there's a healthy part of having cortisol released in our body, but there are also unhealthy levels. And so, that's when we begin to see these stress responses have negative impacts. So typically with high stress levels, we'll see reactions or we'll have experiences in our body where we experience headaches, memory and concentration problems, maybe irritability. And these are pretty common signs of stress in adults. And these events, typically we would talk about, stress at work, or, perhaps we're going through a divorce, or we've lost someone close to us through death, or maybe a prolonged illness or financial issues. In children, it looks a little bit different. That usually the events that trigger stress are fights with friends, it's bullying at school, it's homework, taking a test, maybe birth of a sibling conflicts. Or the other thing that children might experience is also parents having problems. And children do perceive parents having problems. COVID-19 is a situation where, children are certainly aware of what's happening, and it's also creating stress within their family, and they're perceiving this. So the important part here is we want to find ways to reduce those stress levels and decrease this high stress life. Now in children, the stress levels look a little bit differently. We see some common things like headaches, but we might see new or reoccurring bedwetting. We might see decreased or increased appetite, nightmares, sleep disturbances. So these might be some of the physical symptoms. Often you'll hear children making physical complaints, maybe like an upset stomach. So these are some of the physical symptoms that when children are experiencing more stress that they'll express. The other thing that they might express is it might come across in terms of emotional or behavioral symptoms. So they might be experiencing anxiety and worry, or they might find it difficult to relax. Perhaps they have a favorite television show and they just can't quite sit still to watch that particular show. Or you might see new fears emerge or reoccur, such as fear of the dark or being alone. They might express more anger, more irritability. You might see more conflict in relationships. So you do see some changes potentially in children in terms of emotional and some behavioral symptoms when we see stress levels going up. The other thing that I want to note is there are developmental differences for children as we look at stress. So in young children, it looks quite different than it does in adolescents. Adolescents, it's a little bit more like adults in terms of, sleeping and eating disturbances, general agitation, maybe interpersonal conflicts with friends or family, or even concentration issues and physical complaints. In young children, you tend to see things like bedwetting, clinging to parents, sleep disturbances, loss of appetite, fear of the dark. So you are going to see some significant developmental differences that you'll kind of want to attune to as parents. So with that context, I now want to kind of turn to COVID-19. And I just want you to imagine what this is like for a child in this environment. At this point, most children are out of school, and I know that we're currently in summer, so there isn't much school taking place during the summer. But for many children, they were in summer school or had summer activities, and they are thinking about the coming fall semester. They also have no or limited access to family and friends, even neighbors, out of concern for contracting COVID. There's certainly concerns about family, parents, siblings, extended family. They may know people who are ill or may have been ill themselves. They've seen a significant disruption in their social and recreational activities. They're restricted at home, and they may also be exposed to media in terms of news reporting and social media. So what all of this does is it takes children out of their normal routine. And when children are moved out of their normal routines, that begins to elicit kind of some unpredictability about their world. And when we can't predict the world, we tend to experience more stress and anxiety. And in many ways, children don't know what's expected of them in these circumstances, and they're not quite sure what to do. And then to compound all of this, their normal supports are also not available or accessible to them, other than their parents, certainly. So one of the things we're seeing in research about COVID is that children as young as 2 are aware that there are changes. Now, certainly children at 2 aren't aware that COVID is happening, but they are aware that there are changes happening in their family and potentially impacting their family. The other thing that we're seeing, and some preliminary research is suggesting, is that children ages 4 to 10 seem to be most at risk and most susceptible to some of these stress indicators. And as I noted, we're just around the corner of returning to school, and it'd be about this time that children would start shopping for school supplies and doing some of those normal things, and that's currently not happening. In fact, we know that all routines in schools are going to be affected by COVID-19. In some schools they're going to stagger starts. In some schools they're actually going to have half the class come at different times of the week. Lunches are going to likely be at student desks. They won't be in cafeterias, so opportunities to socialize with friends will be reduced. You're going to see teachers, staff, and students are likely to be masked. And so, and one of the reasons why this is important is nonverbal cues like smiles and things like that are pretty important to children. They need to see that to understand the context of some language. Recess and gym activities are likely to be changed. And some schools may be mixing virtual online instruction in with their in-class activities. So we're going to see pretty significant changes, and I think one of the things that'll be more likely this coming fall, in part because rates of infection are increasing, is that we're likely to see more students, staff, and teachers out and sick due to the COVID, and that will potentially have a more stressful impact on children. So again, I want to stress that a part of what COVID is doing is it's really taking away the predictability of what was a fairly normal routine. And because we keep adjusting to what is happening with COVID, it really doesn't allow young children to really adapt to those situations. And if children are able to kind of predict their environment, it usually helps reduce anxiety. But in many of these situations, they really can't predict what's going to happen. And part of our job becomes to help them begin to predict. So, so with that as context, let's now kind of turn to the idea of, so what do we do to cope, and how do we help children cope? Well, the first and maybe the most obvious thing is to start with yourself, because stress is contagious, and if you're stressed, it's likely that your child's going to be stressed. And what we need to be thinking about is, how do we express that? I mean, do we have the news on 24 hours a day and we're attending to what's happening with COVID? Or how are we talking about COVID, and how are we talking about the stress that we might be experiencing from COVID? The other part of it is how are we managing our stress? Are we actively doing and using healthy strategies? This is many of these strategies actually trickle down from parent to child. So if you react with stress, it's likely your child will react with stress. If you react with coping strategies and model coping strategies, your child is more likely to use those strategies. So are you exercising? Are you using meditation or maybe yoga or techniques that would help reduce the stress that you're experiencing in your body? Are you eating in a healthy way? Are you taking time to relax, whether that's through deep breathing, listening to music, reading, and setting up time for yourself to do that? Are you getting good sleep, and do you have good sleep habits? All of these pieces are really important to containing and managing your own stress reactions. The other thing that you can be doing is talk to your children. And, and one of the recommendations I would really have is, let your children guide some of the questions and guide that discussion. And I would schedule regular time to talk with your child. It's likely your child has questions, and it's also a time for you to check in on those stress levels for them. If you remember back earlier, we talked about the idea that sometimes parents aren't making the link between what their child is experiencing in terms of stress and what their child is actually experiencing. And so scheduling time to talk can give you a place to talk about that. The other thing is you want to answer questions truthfully, and there is kind of a developmental issue here that you want to be, again, attuned to what elementary kids need or young children might need versus upper middle school and high school students might need. So younger children need briefer explanations. They don't need all of the details, and much of what they need is to be reassured from adults that adults are going to be there to help them. The other thing is you can give examples of how they can take control in their life. So doing things like wearing a mask and washing your hands for 20 seconds can be really helpful to helping young children begin to experience a sense of control, because that will help with coping. For older children like adolescents, the discussions can be much more in depth. They can think more, in a broader range and consider broader issues and talk about them in more depth. You can be more honest and accurate with them and factual with information, but you can also engage them in decision making. And I think that part is really important. So when you're making decisions in the family, include them in that process, because it, again, gives them a sense of control and empowerment, which will help them cope better. You also, as I noted earlier, want to be really aware of how you're talking about COVID. If you're talking about it in a really, really stressed way, that's probably going to escalate the stress that your child is feeling. Explain some of the concepts like social distancing and wearing masks and why those things are important. And then establish and maintain daily routines. So, plan time, to read so that you're winding down and de-stressing in a sense, or if it's listening to music or, exercising, with your child. So, I notice in my neighborhood, there are a lot of parents that are actually taking their children with them on walks, which I think is terrific. That's a great way to de-stress. I think that, the next thing that we can do, or maybe the next set of strategies, is to be involved with our children. have fun with them. This might be a time that maybe you have some family projects that you want to do together, or maybe you're teaching yourself to de-stress by learning deep breathing and you're teaching your child to do that. Or maybe you take up yoga and begin to practice a little bit of yoga to help de-stress. There are a number of actually really good YouTube videos for both child deep breathing and yoga on YouTube. I also put a link in the resources section for Growing Minds, which provides some really nice tutorials on deep breathing and yoga. You can plan healthy meals together. And like I said, you can spend time actually relaxing together. I also want to note a finding that we learned that of all of the negative things that children talked about in terms of feeling stress and anxiety in reaction to COVID, one of the things that they were actually looking forward to, 72% of children said one of the things that they were looking forward to because of COVID was the ability to spend more time with their parents and family. So we may want to focus a little bit on that positive part, that our children are actually looking forward to this. The other thing you can do is really establish and help follow healthy habits and good hygiene. And again, this is about helping develop and foster that sense of control that children might be feeling or need to feel in order to help reduce stress. The other thing is you can promote healthy eating habits, because that actually helps promote good immune systems. Good sleep habits, and having an established bedtime is really important, because then that starts to establish some routine with your children, and also make sure that they get good healthy rest, which is important to their immune system. And then finally, some other thoughts, and these are just some miscellaneous items. I've hit this several times, but establishing routines, which I know Courtney will talk about next week as she talks about parenting strategies, but establishing a clear sense of routines so that children know what is expected of them, and when things will happen within their family. Monitor television and social media use. Having CNN, Fox, MSNBC, all of those news stations on, probably, I would limit the amount, and I would limit the amount of exposure to children about that. Social media is also a place where misinformation can be often provided as well. And so I think it's really helpful to monitor that. Don't be afraid to correct inaccurate information. Particularly kind of that late elementary, early middle school, they're really susceptible to rumors and kind of fantasy. And so giving them correct information is really helpful. And then I think the other part that's really important is know when to ask for help. So if you need help from a mental health professional, don't be afraid to ask for that help. Often your pediatrician can be a good resource for resources, but there are also resources that are pretty easily found in the communities for support. Certainly at the behavior clinic, we work with children 6 and under, and have been working with a lot of family on COVID issues. So that kind of brings me to the end of my initial thoughts, and I will take you real quickly to the resources. So these were the resources I talked about. This CNN special by Sesame Street is really good for young children in terms of explaining what COVID is. I mean, that would be a great event for you to watch as a family. But there are some other materials here that I would encourage you to take a look at and potentially use. So with that, let me kind of turn it back to Adele.
Thank you very much. This was extremely informative, and I found it very helpful for me too as I looked at the information that you have provided. We have a number of interesting questions. The first question that came out has to deal with the challenges that divorced parents have, with one spouse who seem to be really concerned about the pandemic and concerned and is taking it seriously, and another spouse who thinks that this is really a hoax and this is really not a big issue, and the parent who's more concerned got caught in this discussion. So how do you recommend dealing with those type of situations in which you have a difference of opinion between the parents of the children of what really needs to be done?
Yeah, that's that really challenging situation, and and I think what it's going to take is a conversation between the parents first, so that they align in terms of the strategy. And one thing that the parent can do that is concerned about the safety in particular versus the parent that might be diminishing is to really try to talk with the other parent about what might be best for the child at their child at this particular point, or their children at this particular point, and what might be the safest strategy for them. I might also present facts to them. Here are some of the problems that we have to deal with. Like, we know school is not going to operate in this way. So, maybe get more, break it down a little bit more, rather than the big ideas of, I don't like masks versus I like masks. Because it seems like our political environment is kind of prone to doing that right now. Break it down into more some of the individual problems and try to sort through those problems one at a time. And you might be able to find common ground on that, and maybe try again, to really come to the strategy of what's the safest approach if, this is a concern. And that might be what I would try in that particular situation. I don't know that will help with all divorces. Some divorces are just that contentious. And so in those cases, you might also consider, could you get a mediator of some type involved to help reason through this situation? Because sometimes the two of you just have a difficult time talking with this about that situation and coming to resolution. So this would be one where I wouldn't hesitate to ask for help if those strategies aren't working.
Okay. One question we have about the use of masks in children. Is there an age limit of using the mask? And do you anticipate that kids will be wearing masks in school or some eye protection?
Yeah, we're seeing here in Milwaukee, there is currently a city mandate for masks, and that it will have an impact in schools. I do think that will be district by district and community by community, whether that's a requirement or not. But it is the CDC is encouraging use of masks, and we're certainly seeing children being able to adapt to the use of masks very well. I keep bringing my own children into this situation. I have a young daughter that is currently a nanny, and she's working with two children that are ages, 1.5 and 2, and they're both actually wearing masks without any problem at all. So, children will often take their cues from their parents. If their parents wear the mask, they'll likely wear the mask. And the adults in their lives wear the mask, they'll likely wear the mask. And for some children, you certainly can explain the purpose of it and the reason why we want to do that.
Yeah. This is a rather deep question and a difficult one probably for you to answer, is that, what do you see the long-term impact of this pandemic on children from an education standpoint, learning standpoint, and from psychological standpoint? Do we have any way of determining what could that be, and whether or not there's something we can do to really try to mitigate that?
Yeah, I'll try to break that down the best that I can. It is a really big question, and I will acknowledge that, we haven't seen a situation like this in our lifetime. We've certainly seen events that have disrupted, school and other routines in our families for short periods of time, I lived in the New York area for a long time, and so I certainly witnessed and watched a lot of what happened with 9/11, and there was a lot of disruption at that time. But there was a time where we were able to get back to normal. I don't know with this pandemic how quickly we're going to be able to get back to normal and what normal will look like post-pandemic if that happens. So the long-term effects. So one of the big things I would be most concerned about is children who are around the third grade level, because reading is so important for young children, and then up to that age, around third grade to fourth grade, in establishing those basic reading skills. There's such a connection between disruption in school and not being able to read by the third grade. So that would be one area that I would be concerned about. But I also think that there are things that parents can do in that area. So, one thing is establishing regular reading habits with their children and reading to them, reading with them, and promoting good reading habits. So, that would be one population that I would be concerned about. The other population that I would really be worried about, most children will adapt. Most families will be okay. I think families and children that maybe have experienced trauma in their lives and that has had an impact, this might have a more severe impact and a more long-term emotional impact. And, but, I also don't know. This is an unprecedented situation, but I would expect that they might be more sensitized to stress and react more to stressful situations as a result, and it may carry into adulthood. And so there is that possibility. Again, the things that we can do to mitigate is to promote really positive coping skills and to try to teach and foster that early, because that will mitigate some of the effects of this trauma and the stress that young children are experiencing. So, we don't fully know. We won't know for years, but I think there's things that we can do. We can teach relaxation. We can teach good coping strategies. And in terms of education, one of the primary things is really helping your child read and really develop good reading habits, because that will go a long way in terms of being successful educationally.
Good. We have a question here about the impact on COVID-19 on children's mental health, especially in the inner city, in a situation where there is limited access to internet, limited access to being able to video conference the parents or the child. How are you coping with that, and how is our nation dealing with those challenges?
Yeah, I don't know that we're actually having a great conversation nationally about this area right now. I think it's, from my perspective, I think the conversation is beginning. And we're beginning to think about what some of the strategies are. And, honestly, I think some of this is tied up into the current political environment. I do think that there are strategies that we can use to begin to mitigate that. So I know some cities are beginning to look at the idea of making broadband access to internet more accessible to more people. That would help mitigate some of the inaccessibility of educational services and even mental health services. The other way that mental health is actually responding is with telehealth services. And so those in a relatively short period of time have exploded. People are accessing both physical or regular health services and mental health services on a more regular basis. And I think that's actually a tool that can be really useful to reaching inner city populations more effectively. At the behavior clinic, which I've mentioned a few times, our treatment, the population that we predominantly work with is in the inner city of Milwaukee. That's our target group. Probably 87 to 88% of our families meet the federal guidelines for poverty. And what we're using is telehealth. That's how we're reaching them, and engaging families in these services. So I actually think, providing broadband services and then using telehealth services could be, and in our case, has been pretty effective in working with families.
That's awesome. Well, let me pitch in for the A.V. Korkor Foundations, because we have actually made a commitment, a 5-year commitment, to support the Penfield Clinic program in supporting those type of services to the inner city kids. So I'm really delighted to be involved in the process, and I truly believe that the importance at the Penfield Clinic that is doing is just huge, and it's a service that I think needs to be expanded nationwide, and it's the type of services that is really highly needed. One other question here is that I caught into, and that's actually a question of mine, I caught in on your presentation how kids can really be very observant. We tend to underestimate how they really take their cue from how their parents are behaving and how they are reacting. And and I've heard from some parents, friends and family, is that they're sort of hiding some of the information about them, like the number of people that are dying from it, or the number of cases that are happening. They just feel that it's not important to share those, serious bad news to their kids. What do you feel about that? I noticed that you did talk about transparency and honesty in sharing what's going on with kids, but I think that it's so important to be transparent and honest, and explain to your children that this is a virus that's going to be with us. It's going to be with us for the long haul. It can actually cause people to get very sick and potentially die. So how do we get that message across? Because we know that the kids are watching, and we know that they're hearing it. If they're not hearing it from us, they're hearing it from someone out there.
Yeah, and I'll go back to my presentation. I would start by asking questions of your children and allowing them to ask questions of you, and use that as your guide to respond to what they want to know. And with younger children, you don't have to expand or offer extra details, because often the details won't be helpful to them anyway. What younger children are more worried about is, are you going to help them be safe and take care of themselves? And you can offer reassurance to them in that way. Older children, like older middle school and high school students, can be more. You can be more disclosing with them in terms of the direct facts, and be more honest about what's happening. Or be more disclosing about those details, because they're in a better position to navigate that information, make sense of it, discuss it with you, and then again, think about what that means for their behavior. And so I think I would, as much as possible, be accurate in your information, but also really be attuned to that developmental level, and follow your child. They will have questions. I think because parents are afraid, they don't ask their child, what questions do you have of me? Or what do you want to know about this situation? And that's why I encourage, have a weekly meeting, where you talk about what's happening, and you answer those questions, because the questions are there. It's just a matter of whether children feel safe to ask those questions with their parents. And I would just invite that.
Yeah. I have a question here about whether having pets is really of any help to try to mitigate some of the anxiety in the family. Where do you see that? Yeah,
I think actually pets can be a great resource, and we see them used, I actually know at our university counseling center, they have a therapy dog there. A couple of my daughters in different high schools had therapy dogs, a couple of therapy dogs in their school. So cats can be a great resource and a great source of comfort. So I see nothing wrong with that. I certainly would be, I would want a pet that is family friendly and can manage if you have young children, can manage young children. But beyond that, I think they can be a great resource and a great source of comfort.
That's awesome. All right, I think we're coming to the end of our discussion here because we don't have any more questions. And I certainly feel that you've addressed really this topic incredibly well. And I really very much enjoyed the presentation, and I am sure that the rest of us have. So thank you so much, Dr. Ellen Burkard from Marquette University here in Milwaukee, Wisconsin, a great school and a great partner. And thank you so much. And thank you everybody that's been watching this webinar. And I look forward to seeing our next week webinar with Dr. Courtney Black in talking to the parents, addressing the parents and how to cope with these challenges. So thank you so much, and I look forward to seeing you again in future webinars. Thanks to all of you. Have a great day.